everyone. Welcome to week number 1. This week what we're going to be focusing on is professionalism and safety within the medical office. Excuse me. The professionalism will deal with chapter 1 for this week, and safety will come from chapters 34 and one page out of chapter 55. That's going to be page 1291. So let's start off with chapter 1. Let's talk about professionalism. But before we can really kind of dive into what makes a professional medical assistant, you need to understand what your role and what your responsibilities as a medical assistant would be. So let's start off with roles. So your main role as a medical assistant will be to assist the provider with, or the physician, with anything that they need, whether that be help with things such as obtaining vital signs or getting specimen collection, whether it's helping to administer medications or help during procedures that they might do. Your main role will be to help that person. That's what your job is. Okay? But you may also have to do some administrative tasks. And when I say administrative tasks, what I'm talking about are things like functioning as a front receptionist. If you've ever walked in, there are people that greet you. They take your co-payment. They make sure your insurance is up to date. Those are the kinds of things that you may be asked to do, but that's normally in a smaller office. Larger offices will have designated front desk staff to do those things. The next thing I want to talk about is responsibility. So you know your main role is really to help that provider. But what are your responsibilities? Because medical assistants, the responsibilities that they take on are so extensive, you have to make sure that you have the proper education and training. So that's why it's great that you're going through what you're going through with Rasmussen, because we train you to the best, and we make sure that you are responsible and you can handle the responsibilities of a medical assistant. Okay? You want to make sure, just like you get here at Rasmussen, you want to have not only the theory portion, but the hands-on portion as well, because that's how most people learn, is they learn from doing. It's going to be your duty and responsibility to do things that the office will ask, but you need to understand that every office is different. Just because you do something in one office and you transfer does not mean that that office functions the exact same way. So make sure that when you go to a new facility, you make sure you understand what your responsibilities as a medical assistant are. Medical assistants really are divided into two groups. They're divided into clinical and administrative. Now, administrative is something that you don't have to do very often, but doesn't mean that you won't ever have to do it. So I want to make sure that you understand what administrative responsibilities are. So it can be things like scheduling patients. They can be things such as greeting patients or updating and filing their patient records, handling financial things with patients, like I said, taking co-payments or maybe helping them pay a bill. You're going to handle the mailing and the billing and insurance claims part of the administrative tasks, and you're going to also be able to handle petty cash. On the opposite side, clinical people are going to be doing things like obtaining a medical history, obtaining vital signs, performing lab procedures. They're going to be performing venipuncture. It's also a clinical responsibility to make sure that you do an inventory check. When you get into clinical skills 2, we actually have you do a routine inventory check, so be prepared for that in the next couple of quarters. You're also responsible for handling drug refills, and you need to understand how those work. We will talk about those later in this quarter. And then you're also going to be responsible for sterilizing the medical equipment that you use during procedures. Alright, so those are kind of the basic roles and responsibilities of a medical assistant. Let's talk about what makes a good medical assistant. What characteristics make you a good medical assistant? The first one always is integrity. Be honest with everything that you do. Be honest with your job. Don't lie to try to make yourself look better. Be as honest as you possibly can. Empathy is the next one, and that means that you can put yourself in your patient's shoes. You can feel what they're feeling without being overly sympathetic. You can empathize with them, but you want to try not to show too many emotions, because then that makes you very vulnerable. Discretion. then this is really the ability to make a good, sound judgment. Make sure that you're making good judgments at work, because you don't want something simple and silly to get you, in trouble. So make sure you're making those good decisions. Confidentiality makes that one kind of self-explanatory. You want to make sure that you're keeping things private. If somebody doesn't need to know something, we don't tell them. Okay? Thoroughness. Pretty much that's your ability to multitask. In a medical office, things happen very quickly, and you want to make sure you can jump from task to task. Punctuality. Be on time. It's even better to be early. But make sure that you're always accountable for those people, because they want to make sure they can count on you and that you're punctual. Congeniality. Make sure that you can work with a diverse group of people. Not everyone in your office or even sitting around you in the classroom is just like you, so make sure that you can work with everyone around you. Proactivity. Make sure that you can take charge and you can anticipate what's coming. Anticipate what your doctor might need. If you know that he's going in and he might do a procedure, have the equipment ready so that way if he comes out and says he wants to do it, you've got it there for him. He doesn't have to wait on you. And the last one is competency, and that's really keeping up with your skills. So it's really important that you, attend educational sessions where you keep up to date with the current medical issues that are at hand. So that way you can be as competent and on top of things as possible. Alright, so that is Chapter 1 in a nutshell. Let's move to Chapter 34. That's really dealing with safety. But what I want to focus on in this chapter is going to be the infection control process and how we reduce the infection control and how we reduce the spread of infection. So, first thing that you really need to know with this chapter is the chain of infection. How does an infection get spread? Okay. The first step in a chain of infection is always a reservoir host. They're really the person that holds that pathogen or that infection within their body. Okay, it doesn't just have to be a person; it could be an animal as well. Think about mosquitoes with swine flu. Okay. After you've got that reservoir host, the next step or next link in the chain of infection is going to be a portal of exit. Okay, it got into the body, now it needs to exit so it can infect other people. It can go out through any, nasal. It can go out through really any host or any orifice out of your body. Most commonly it comes out in sneezing or coughing, but it could come out in a bowel movement, urine, reproductive tract, anything like that. Now that it's out, it's got to have a way to transport itself. So that's going to be a means of transportation. That's link number 3. And that's essentially how it's going to be transferred. This can happen through direct contact, like shaking of hands, or indirect contact, like if you sneeze and somebody around you happens to be in that area, they can ingest that just from being in the area. It's not a direct contact, though. After it's transported, it needs to find a way back into a new body, so that's going to be link number 4, portal of entry. And just the same as how it came out, it can go back in. It can go in through your nose, your eyes, your mouth, your reproductive tract, anything like that, it can go back in the way that it came out. And the last step, or the last link in the chain of infection, is a susceptible host. Once the pathogen is in the body, it's got to make sure that it can work with that body and it can be able to spread that infection. Once that happens, it kind of starts to cycle back over. So you go back to your reservoir host, to portal of exit, means of transmission, portal of entry, susceptible host, back up to the top, and that's kind of how the cycle works, okay? You need to know that because this is going to be part of a test or quiz or final later in this semester, so I want to make sure that you understand that, okay? And that's really all I want to talk about with Chapter 34. I'm not going to discuss 55 because we will spend a great deal of class time talking about bloodborne pathogens and how we can stop the transmission of those as well. So I'm not going to do too much of that, but it is your responsibility as a student to make sure that you read all 3 chapters, or at least Chapter 1 and Chapter 34, and look over page 291 in your book. Please make sure that you do that because you'll never know what might be coming in class. So I want to make sure that you are up to date as possible, okay? As a reminder, I want to make sure that you guys understand you have your discussion post that is due Tuesday night. Your initial post is due. Your 2 responses will be due on Saturday at midnight. You will also have 2 written assignments this week. One is a worksheet talking about evacuation plan. It's a little worksheet. You'll have to download it and you'll put in your answers. But you'll also have to create a fire, a fire prevention pamphlet, and you'll also have to create an evacuation plan for if there was a serious injury. Okay. The second one, second assignment, you'll be talking about the Code of Ethics dealing with medical assistance. This should be about a 2 to 3 page paper, and it should be in APA format. Now, if you don't know what APA format is, don't panic. I'm going to put up some little links to help you underneath the course announcement. You can click on those and download them. If not, always reach out to me or the Ask the Librarian function on your Angel platform. All right, guys. I look forward to seeing everyone on Wednesday. Have a wonderful day, and come to class ready. Bye, guys.